Hello everyone, my name is Professor Petrus de Vries. I'm from the University of Cape Town in South Africa, and I'm here with Professor Jansen from the Vrije University in Brussels. We are in Leuven in Belgium, and we've just had the launch of a very exciting new project called the TANDem project. And maybe you can say something about the TANDem project and the ideas around it.
So the aim of the TANDem project is to empower patients and families living with tuberous sclerosis complex with TSC to tackle the assessment and the treatment gap for TSC-associated neuropsychiatric disorders, or TAND. So maybe you can explain how we are planning to do this.
Yeah, and I think it's important just also to re-emphasize that of all the manifestations of tuberous sclerosis that people might live with, epilepsy, physical, kidney, brain, heart, whatever, these TAND manifestations, the neuropsychiatric, neurodevelopmental, mental health, educational issues, are the biggest burden to families and are the things that people around the world know the least about how to identify it and how to treat it.
Maybe I can add to that not only families struggle with it, but also physicians struggle with it, because many physicians that see families and patients with TSC are not so familiar with TAND. They don't know really well what the concept is, but even more, when there are difficulties, they find it very hard to make sure that families get the right care. So for physicians also there's a twofold challenge. It's knowing what it's about, it's being able to really diagnose it and to know what's going on the one hand, and then when they have identified what is the problem, it's also a challenge to find the right people to guide and accompany these families and these patients. So not only for the families, but also for physicians, it's important to have more tools and guidance in how to proceed.
Yeah. And so what have we done so far? Firstly, we coined the term TAND as a way of at least giving the message to people in the TSC community that there's this group of significant challenges. Second thing we did, we invented or made up a TAND checklist that could help people identify and look for the key challenges in TSC, associated neuropsychiatric disorders. What we then did was to ask people in the community what are the concerns and what are the priorities. And so families, people who live with TSC and others said to us, can you please make a version of the TAND checklist that we can fill in? So a self-report version. Can you please make a version that's a little bit more quantified so that we can say how much of a problem all these different issues are for us? And the third thing that families then said to us was, can you please put these things on a tablet or a smartphone, so using technology, so that we can access that checklist more easily. And so the first aim of our TANDem project is to develop a self-report questionnaire, to quantify it, and to build it into an app so that anybody around the world can use it. So that's aim one. Maybe you can say something about aim two. So
I think it's also what the family said afterwards is when we have this app and we can see like what aspects of TAND are we struggling with and how severe it is, the very important question then is what can we do about it? How can we make things better? And instead of just waiting for a referral, which can take sometimes a very long time, or you might not find somebody who can really help you right away when you're in need. The idea is then to develop guidelines, recommendations as evidence-based as possible to build into the app as a sort of toolkit, so that when you identified your TAND profile and the issues that you might struggle with, that you then might identify what are things that I can already put in place or try to make things better, or where can I find additional help, or which kind of people could I reach out to improve my situation. I don't know if you want to add something more to that?
No. So aim two of the project is to scope the literature about what evidence there is existing, to have a process of building consensus clinical guidelines for next steps, for tools, for tips for families, and of course for professionals, and then to build it into the app so that once you filled in the the TAN checklist on the app, you can also access tips, advice, information and relevant treatment options for yourself or for your child. And so the third aim of the TANDem project is a broader one. We're conscious that there are not enough people who do research on TAND in the global TSC community. We're conscious that people don't know enough about TAND broadly, families and professionals. And we're conscious that there's a new generation of researchers, of clinicians that might benefit from having some fostering and encouragement and mentoring in the field of TSC, but specifically in the field of TAND. And so the third aim of our project is a kind of a networking aim, a capacity building aim, and an impact in the global community of TSC aim. And for that, we will have a range of activities at conferences, supporting early career researchers, facilitating interactions, linking communities, and a range of other impact activities that will run over the course of the 4 years of the project.